It is my duty to inform the House that the Speaker is unavoidably absent. Therefore, in accordance with the statutes, I would ask the Deputy Speaker to please take the chair.
O eternal and almighty God, from whom all power and wisdom come, we are assembled here before thee to frame such laws as may tend to the welfare and prosperity of our province. Grant, O merciful God, we pray thee, that we may desire only that which is in accordance with thy will, that we may seek it with wisdom and know it with certainty and accomplish it perfectly, for the glory and honor of thy name and for the welfare of all our people. Amen. We acknowledge we are gathered on Treaty 1 territory and that Manitoba is located on the treaty territories and ancestral lands of the Anishinaabeg, Anishinaabe, Kanuwak, Dakota Atay, Denisuli, and Nahathawug nations. We acknowledge Manitoba is located on the homeland of the the Red River Métis. We acknowledge northern Manitoba includes lands that were and are the ancestral lands of the Inuit. We respect the spirit and intent of treaties and treaty making and remain committed to working in partnership with First Nations, Inuit, and Métis people in the spirit of truth, reconciliation, and collaboration. Good morning, everybody. Please be seated. Orders of the day, private members' business. The Honourable Member for Concordia.
Thank you very much, Mr. Deputy Speaker. This morning I would ask that we call Bill number 235, the Public Schools Amendment Act, Nutrition Programs, for second reading.
It has been announced by the Honourable Member for Concordia that Bill number 235, the Public Schools Amendment Act, be now called and read, called for second reading and debate. The Honourable Member for Transcona.
Thank you, Deputy Speaker. I move, seconded by the member for Notre Dame, that Bill 235, the Public Schools Amendment Act, Nutrition Program, be now read a second time and be referred to a committee of this House.
It has been moved by the Honourable Member for Transcona, seconded by the Honourable Member for Notre Dame, that Bill 235, the Public Schools Amendment Act, Nutrition Programs, be now read a second time and be referred to a committee of this House. The Honourable Member for Transcona.
Thank you, Deputy Speaker. This bill amends the Public Schools Act to require the minister to report each year by school division and district that schools provide or will provide these nutrition programs and give a review of what is out there in Manitoba. It's an important bill. It helps with the Manitoba's Healthy School Initiative, provides important data so that we can make important decisions here in this House to support kids, support their experience at school, support their families. And especially at this time, Deputy Speaker, as we're coming out of pandemic, we know that many families were certainly impacted by the pandemic, and they are now in the midst of recovering. So what better way to help families recover, especially families that are working really hard to provide the necessities of life to their kids, to their communities. One right at this point where we have many Manitobans that do work minimum wage jobs. Minimum wage jobs certainly don't provide the necessary funds to support a growing family. And this is a way that a school can do that. But more importantly, what this bill does is provide the data. What's out there? What's the lay of the land regarding nutrition programs in Manitoba? Right now, the Child Nutrition Council of Manitoba does provide a bit of a snapshot of what's out there, but that data is sporadic. It's not complete, and it allows for, I think, too much of an emphasis here on Winnipeg, because many of the programs that the Child Nutrition Council supports are located here in the capital city. What this bill will do is get a snapshot also of what's occurring in schools and school districts outside of Winnipeg, which will give a really important snapshot as to what's required. And it's kind of a bit of a precursor, something that can provide the department's Healthy School Initiative a real reason to step in and to provide these programs universally throughout the province. We do know that nutrition programs are seen as something that's a curricular support, something that's part of a child's school day. We do have many examples in many developed countries throughout the world where nutrition programs are used and an integral part of a child's school day. I've spoken a lot about what happens in Scandinavian countries. Ontario right now is looking at implementing a program that is similar to what happens in Scandinavian countries. And we have throughout Canada different applications of nutrition programs in schools because they see it as a cognitive piece, something that can help kids be better learners. But the other thing it does, Deputy Speaker, is that it allows for a creation of community. Because what we see is when we have nutrition programs, what we see is we have more parents become involved in the school day. And what does that do? Well, it helps, Deputy Speaker, in breaking down some of those barriers that we have seen exist when people have school aversion. We do know the impact of residential school and intergenerational trauma. And there's real school aversion that can be overcome by having programs like this, where we invite the community in to not only be a part of the nutrition program, but also help in providing and working in the nutrition program. In some of the schools that I was exposed to, one of the things that you noticed really, really quickly is when nutrition programs were in place, that there was a strong community connection. Parents walking their kids to school often, parents coming after their night shift, walking their kids to school and then sitting down with their child in Polson School, actually, having breakfast, getting ready for the day, and then handing their child over to the school. What we noticed, though, when we were some of the schools that I worked at, is that it was more than just breakfast, Deputy Speaker. We began to notice that there was a need for providing nutrition to kids throughout the day. So what we did is we adjusted. While the breakfast program still existed, Deputy Speaker, we also had snack throughout the day. And the way snack was taken care of is that we had carts that were wheeled out that followed a lot of the Child Nutrition Council's recommendations for nutrition level in the snacks that were provided to kids. Because sometimes we had kids arrive at school not at that traditional time at the beginning of the day. Sometimes they would come in either after appointments or just getting ready for the day at home, or sometimes delay them, where they would need some nutrition and some sustenance to get them through the day. I can talk about the research behind this, Deputy Speaker. It is well established that having adequate nutrition certainly helps not only in cognitive development, but also it settles the body down. It gets you ready to learn. And that is a term that has been used in schools since I started working in schools back in the 80s. The ready to learn piece is something that's important. It gets kids in that right frame of mind to get ready to learn at school and to be a contributing member of their communities. You will find too that with the data provided, with Bill 235 is that the province can then map out what a nutrition program province-wide can look like, what the needs are, and then establish some really solid guidelines for the nutrition component of the program. And the data here that will be generated is really important, and one that can provide and help provide, a roadmap moving forward in this important program. I will say that the important work, I do want to lift up the people at the Child Nutrition Council. They noticed a void. And so what the Child Nutrition Council did in the early 2000s is partner with the Manitoba School Boards Association. And because the Manitoba School Boards Association noticed a gap, noticed that kids were coming to school hungry, and they needed to ensure or find a way to support kids and families that were experiencing that. We do know the ravages of child poverty, but it's not just child poverty. This is poverty in general, Deputy Speaker, in Manitoba. And one of these things, as I talked about in my earlier remarks, is coming out of the pandemic, it provides opportunities, Deputy Speaker, for us to provide the programming that is necessary for kids to be successful at school. Here is one of those pieces. With, Deputy Speaker, what I said earlier, with reams of data that supports these programs and how they positively impact a child's experience at school and in their community. I think, like I said earlier, that one of the really important benefits of having nutrition programs in school is how it helps build community. I recall in my experience in a couple of places that I worked at where some parents had their first exposure at school by coming through the nutrition program. Eventually, those same parents would work in our lunch program, lunch supervision program, and then from lunch supervision program, they used that as a springboard to apply to become an educational assistant, and were then able to support their families. Their children see them as contributing to their school community. It just builds a really positive culture, Deputy Speaker, that really lifted a number of families, not just out of poverty when it comes to dollars and cents, but also poverty and being exposed to your community. It gets people together. It gets them together to talk about solutions to problems that may be occurring in the neighborhood. It just acted as a real community hub. And these are some of the compelling reasons, other than the pedagogical curricular ones that we know that nutrition provides, but the data collected from Bill 235 can help the province plan for success for kids at school. Like I said earlier, the pandemic has exposed many cracks. Here's a way, a tangible way, let's collect the data, and then using that data, design programs that will support kids and families in school so that they can be successful learners, but more importantly, see themselves as community members, Deputy Speaker. And I look forward to debate on this PMR. Thank you.
A question period of up to 10 minutes will be held. Questions may be addressed to the sponsoring member by any member in the following sequence. The first question to be asked by a member from another party, and that's to be followed by a rotation between the parties. Each independent member can ask one question, and no question shall exceed 45 seconds. The honourable member for Borderland.
Thank you, Mr. Deputy Speaker. I'm wondering if the member could advise who was consulted in the drafting of this legislation.
The honourable member for Transcona.
Who we consulted? Okay. I want to thank the member for Borderland for that question. I talked extensively with schools in River East Transcona School Division. I also talked with the Child Nutrition Council, and I also had a conversation with the I forget if he's the director of the Manitoba School Boards Association regarding these programs. Both indicated, or all always indicate, how the programs are now evolving into providing nutrition throughout the day. And this is something that's really important. It allows it to be a little more nimble because it's not just breakfast, as I said earlier, Deputy Speaker. This is something that is evolving, that is going throughout the day. So I want to thank the member for that.
The member's time has expired. The honourable member for Point Douglas.
Which, Deputy Speaker, I want to thank my colleague, the member from Transcona, for bringing this very important bill forward that, speaks to the future of our children. I'd like to ask the member what experience they have as an educator that makes them believe that this bill and universal nutrition programs more broadly are so important.
The honourable member for Transcona.
I want to thank my colleague for the question. I know my colleague, the member from Point Douglas, also has a lot of experience in public schools and knows the value of nutrition programs. But most importantly, one of the things that I really noticed, Deputy Speaker, was that kids that were school averse, this is a way that we got them into school. I still remember certain kids that were not very successful in a very traditional environment. But you know what? You invite them in for a meal, sit them down, and have some really, really good conversations. Get to know the child, what the barriers are for them. What a nutrition program allows for is another avenue, a more non-traditional avenue to get to know the child and
The
their
member's
background.
time has expired. The honourable member for Tyndall Park.
Thank you, Mr. Deputy Speaker. A couple of weeks ago, I introduced a resolution increasing investment to school nutrition programs, and through this process, I really learned the importance of consulting with MTS, the Manitoba's Teacher Society, and the Child Nutrition Council of Manitoba. The member has not talked about or referenced MTS at all throughout his introductory remarks, but I'm wondering specifically about CNCM, when did he consult with them?
The honourable member for Transcona.
I know one of the board members at CNC, and I did consult with them, a few weeks back. I don't know exactly who or that part was difficult. So I will say that I'll do a better job of that. So thank you.
The honourable member for Seine River.
Thank you, Deputy Speaker, and I'd also like to thank the member from Transcona for this bill. Can the member answer what detailed information about the type of nutrition program is required to be submitted by the school boards?
The honourable member for Transcona.
What we would do is just ask if meal programs are being provided at the school and how they're being administered. So if they're being supported by CNC or if they're being supported by just the school going out into the community and getting support for their meal program. So that's what we would want some data on. Yep. Thank you.
The honourable member for Point Douglas.
Which, Deputy Speaker, can the member tell us what will this government be able to do with the information that will be reported if this legislation is passed?
The honourable member for Transcona.
I want to thank the member for that question. With the information, what it does is that provides data, important data, so that the government can cost out a program if they were willing to go down this road for nutrition programs. It also would give an indication as to where they can source some of these pieces and who some of the community partners that can be involved in providing this. So I think it would be really important just to see and get a snapshot, Deputy Speaker.
The honourable member for Borderland.
Thank you, Mr. Deputy Speaker. I'm wondering if the member could expand a little bit more on and share with the House what the what school divisions had to say on this bill.
The honourable member for Transcona.
Thank you, Deputy Speaker. And again, I want to thank the member for Borderland for that question. What school divisions have noticed coming out of the pandemic is that as kids were coming back, they're starting to see that some were really suffering from not being able to be in these community-based programs like a school nutrition program. And they noticed that kids were we're having a hard time coming back and reintegrating back into that school environment. And what some school divisions are saying is that it would be nice to have a bit of a direction from the provincial government regarding this. Like I said earlier in my remarks, there are many programs that are out there throughout the world, and many developed countries, many models that we
Member's time has expired. The honourable member for Point Douglas.
Miigwech, Deputy Speaker. I'm wondering if the member can speak to absenteeism and how this would affect children in schools to have nutritious programs provided for them.
The honourable member for Transcona.
I do, in my experience working with kids in schools, the nutrition program acted as a draw to school. And then once they were at school, we were able to provide the supports that child needed to thrive in a learning environment. A lot of times a kid just needs to be able to sit down, calm themselves, get themselves ready for the school day, and ensure that they're ready to learn, something that, of course, a lot of us as teachers know, and I know there's a number here in the House that were teachers and understand that term. So thank you, Deputy Speaker, and thank you.
The honourable member for Seine River.
Thank you, Deputy Speaker. Could the member opposite tell us who would be seen as the administrator of this report?
The honourable member for Transcona.
I think I heard who would be the administrator of the program. Okay. What we can do, this is an opportunity to work with the Child Nutrition Council to have them provide, because they already have a lot of the experience, Deputy Speaker, in providing this program, and I think that would be a good place to start as a group that would administer something like this or help collect some of the data as well.
The honourable member for Point Douglas.
Miigwech, Deputy Speaker. The Auditor General recently surveyed school leaders. They said that they don't believe this government is providing what children need to recover from the pandemic. How can nutrition programs help families recover from the pandemic?
The honourable member for Transcona.
I want to thank the member for Point Douglas for asking that. It can help recover from the pandemic because we do know that many families struggled in providing support for their kids and providing necessities of life at home because they were restricted in the work that they can do. Typically, people that work in minimum wage jobs or the front line, like they were front facing and had difficulty going to work. You couldn't go to work to earn money to support your family. So this is another opportunity for that to happen. And again, coming out of the pandemic, you need to see this as an opportunity, Deputy Speaker, so that we can provide yet another support.
The member's time has expired. The honourable member for Borderland.
Thank you again, Mr. Deputy Speaker. I'm wondering if the member could explain why the onus would be on the school divisions to collect and publish data on the number of students participating in each program.
The honourable member for Transcona.
I want to thank the member for that question. School divisions and school leaders and the people that work in schools know their kids best, Deputy Speaker. They're the ones that are the real front-facing workers that can certainly provide that data. I know if I were to be, all it is if my school division had asked me to provide that, I would just say I had a breakfast program and I had a snack program that occurred throughout the day, and that would be enough of the data that would be required by this bill to get it through. So, thank you.
The honourable member for Point Douglas.
Miigwech, Deputy Speaker. When the Manitoba NDP last proposed a universal nutrition program, the MLA for Radisson said, and I quote, "I'm not interested in the universal don't have breakfast with your family approach." Is the Manitoba NDP actually opposed to children having breakfast with their parents?
The honourable member for Transcona.
No, we're not. But I think what the pandemic has seen is it does allow us to evolve in our thinking when it comes to nutrition programs. I'm not going to, I don't know what's in certain members' minds, but I do know that coming out of the pandemic, it has certainly challenged us to provide what's needed for schools and for kids. And here's an opportunity that we can't miss to ensure that we provide nutrition for kids that need it when they're at school. Thanks, Deputy Speaker.
The time for questions has expired. The floor is open for debate. The Honourable Minister of Education.
Thank you, Mr. Deputy Speaker, and it gives me a great pleasure and honor to stand today and put a few words on the record in regards to Bill 35, Mr. Deputy Speaker. And I'd like to thank the MLA for Transcona, my friend from Transcona, for bringing forward this bill, because it gives us an opportunity to chat and have a bit of a debate on something that's very important in Manitoba, Mr. Deputy Speaker, the Public Schools Amendment Act nutrition program. So as some of the questioning had already started during the question period, we on this side of the House, and I'll say that our government likes to and I think has done a great job collaborating and working with our education partners throughout this whole province of ours, Mr. Deputy Speaker. And I look to the bill and I see some validity to the premise of it, absolutely. I think, you know, as the member had stated, you know, he spoke with his own school division. He spoke with some director, he thinks, a few weeks ago in regards to the Child Nutrition Council, and then also possibly a director from the Manitoba School Boards Association. We take this topic of whether it's poverty or learning and various different things that contribute to student success very seriously, Mr. Deputy Speaker, and we're working with various education partners all across this great province of ours. And so with this, I'm almost thinking, you know, as far as the legislation, and the member is bringing this forward as a piece of legislation, as opposed to potentially, you know, having that discussion with myself as the Education and Early Childhood Learning Minister, or some of our other colleagues, because this is not just an education approach, Mr. Deputy Speaker. This is definitely nutrition. This goes all across this great province of ours, Mr. Deputy Speaker, and I think that this is a topic that potentially could be actually with a little bit of an olive branch here, Mr. Deputy Speaker. I'd much like to work with the member from Transcona on maybe not having to go with such a rigid thou shalt approach as far as a piece of legislation, but possibly even work with him and working with those education partners across the province on building certain policies or different things that we could be asking school divisions for those pieces of information. I think it could just be simply, as you know, as the member from Tyndall Park mentioned. I mean, it's as easy as picking up the phone and having those conversations, and not expecting that the answer is going to be there as soon as they answer the phone, but it continues with the conversation and trying to get the information out there. Our government had created the Provincial Task Force on Poverty and Education with intersectoral stakeholders from across Manitoba to explore the impacts of poverty on education, to identify actionable strategies to remove the barriers to the participation in learning, and work in connection with the province's poverty reduction strategy. Public engagement is currently underway, Mr. Deputy Speaker. This task force has established a subcommittee on nutrition and food security, and I am looking forward to hearing the results of their consultations and recommendations. And when that comes forward as well, Mr. Deputy Speaker, I will definitely be inviting the member from Transcona into my office to get a briefing on those results. We know that the Child Nutrition Council of Manitoba is to be commended for supporting more than 271 programs, reaching more than over 33, probably closer to 35,000 students, Mr. Deputy Speaker. As well as the member from Transcona did mention, the great work of our Healthy Schools in Manitoba initiative, which is to promote the physical, emotional, and social health of school communities. And it's also based on the belief that good health is important for learning, and that schools in a unique position to have a positive influence on the health of children, youth, and their families. Healthy Schools has identified 6 health topics, Mr. Deputy Speaker, as priorities within the school community: healthy eating, mental health, physical activity, safety and injury prevention, sexual health, and substance abuse and addictions. The member knows that because him and I have shared a few conversations about our history and our former careers before we got into this wonderful, honorable occupation, Mr. Deputy Speaker. This coming September would have started my 29th year of teaching, and I know that the member from Transcona has me beat on that a little bit, but definitely the experience is definitely there. We know that within the schools, we have nutritional programs, we have courses to help with not only the students themselves, but then having those conversations with parents and guardians, and having, Manitoba school boards have those discussions with then their administration and then teachers, of course, which then deliver the programs to the students. All through the early years and middle years, we've got the home ec courses, 7 and 8, and teaching, basically not just the food guide, Mr. Deputy Speaker, but also many other good, positive outcomes and teachable moments on healthy lifestyles and what they can do not only in school but outside of school in either their extracurricular time or at home, Mr. Deputy Speaker. I also know that the Healthy Schools initiatives are more successful if they involve everyone: school leaders, students and their families, staff, and a whole school community. When there's leadership support and everyone is committed, health promoting activities can be very well planned, coordinated, implemented, and sustainable over the long term. I would like to bring the attention also, Mr. Deputy Speaker, to a couple other things. I know that the member from Transcona mentioned on how, post-pandemic, but also during the pandemic and previously to the pandemic, that families are working hard, really hard, to provide necessities of life to make sure that their nutritional avenues, they're able to not only teach their kids but send their kids to either school or have those breakfast programs, as the member mentions, within the schools. I think it is relatively easy to be able to sit down and create those policies and ask school divisions those basic questions that he mentioned. I know that he hasn't had an opportunity to really consult with many of those stakeholders, but I think a lot of that process is well underway, and definitely we can ask for some of that data to be back. And again, we'll be looking forward to a lot of the recommendations and the findings from the Education and Poverty Task Force as well, Mr. Deputy Speaker. So back on and I quote the member from Transcona talking about how really hard that families have to work to be able to provide. That is one thing that I'm hoping that this afternoon that the member will vote in favor of Bill 39 and move it forward to committee, because within that bill, and not only the bill but also the budget, we have provided in Budget 2022 quite a significant opportunity to basically make life more affordable, Mr. Deputy Speaker. Whether it's the education tax off of property, which is going to be about 37.5%, once that budget gets fully passed. I know that the members opposite have voted against that, so I'm not quite sure why he's talking about how hard families have to work, yet will vote against something that will have a major tax relief to over 455,000 homes, Mr. Deputy Speaker, which then, it's basic math. Even the NDP can do the math, Mr. Deputy Speaker, that brings in a savings of well over 900,000 individuals. And that's just simple times the households by 2, Mr. Deputy Speaker. In addition to that, over $500 on tax relief to renters, Mr. Deputy Speaker. So I'm really strongly encouraging the members to vote in favor of that bill, but also I do look forward to working with the member on policies moving forward in regards to nutrition, Mr. Deputy Speaker. Thank you.
The honourable member for Point Douglas.
Miigwech, Deputy Speaker. I want to thank my colleague again for bringing forward this very important bill. We have a lot of children in Manitoba who, require food to learn. As an educator myself, I know, and actually as a student, as a child myself that grew up in poverty, I know how important it is to have those programs at school, especially for, a child that doesn't have lunch. They will choose not to go to school because other kids are pulling out their lunch and eating. So they'll skip school. They'll go out into the community, their parents think they're going to school perhaps. They might get into some trouble, they might get exploited. Like there's all sorts of ramifications for not providing nutrition programs in schools. I had the opportunity several times to go into many schools. Child Nutrition Council invited me into some of the schools in my community to come and actually see what a nutrition program is like, whether that was breakfast or lunch, and the impact that it has on those families and those children. As an educator myself, I saw the impacts that it had on many children, many families who, won't benefit from Bill 39, as the member from Lac du Bonnet had referenced, that this is going to make life more affordable. It may make life more affordable for someone who is a corporate landlord that doesn't need that extra funds, but someone who's on EIA that hasn't had an increase in their benefits for, a number of years, certainly the last 6 under this government, food has gone up and families are struggling. And this Bill 39 is certainly not going to benefit them in terms of nutrition and making sure that they have the food that they need to learn, but also to make sure that they're going to school. We have a real absenteeism problem in this province. This government has failed to address that, and a big part of that, out of the report, came nutrition. Families cannot afford to feed their kids in the morning, and I know the member from Radisson loves to eat breakfast with his children, and that's great. He can afford to, provide that food, but we also need to think about those families that would also love to have that breakfast with their family, but can't afford it, and goes to the school, to have a nutritious program with other kids, and like the member from Transcona said, it builds community. It brings kids together. It brings parents into the school, because these programs are often run by parents who may not be getting paid. They may be, volunteering their time. They may be volunteering to get some experience to, possibly go on to become an EA, as the member from Transcona said. But it's also about, having their children see that education is important, that nutrition is important. And the schools, when they're providing these nutrition programs, they are looking at the nutrition of these kids and making sure that they are, meeting the basic food groups, that they are getting healthy food. Sometimes, and I know I've gone to Harvest and helped, pack food hampers for families, and even during the pandemic, some of the community organizations putting together hampers for families. And Harvest gets food that, people donate, and a lot of times it doesn't contain eggs, which is a protein, so they're given things like chili. And I've seen this in the North End schools, where schools don't have the funds to be able to make, pancakes or eggs or bacon, stuff like that. Stuff, even bagels. And I know the member from Radisson, we were talking the other day about, he had breakfast with his children and it was bagels, and we were laughing because it was like, well, was it homemade bagels? But it wasn't. But Even those types of things, like they take whatever they get donated. And children were eating chili for breakfast from a can. Not something that I personally would feed my children if I had a choice, but because they don't have a choice, that's what children are having to eat. And I've said that in this house many times. When I was the family's critic, I talked about nutrition in schools and how important it was, and what we were seeing in the inner city schools, especially with no EIA increases. And certainly this government could provide supports for nutrition programs in schools so that kids aren't going hungry or they're not skipping class. And again, some people have the means to be able to feed children. And the member from Lac du Bonny referenced the poverty reduction strategy. Well, when the NDP was in government, we actually had markers. We had actually objectives, and we had, goals to meet. And this government has actually taken away those objectives. They actually don't report on poverty anymore. There actually isn't a committee for members to come and speak to the poverty strategy that is non-existent from this government. I haven't heard any report from this government in the last 2 years, and the member from Lac du Bonny is saying that, that they've produced a report and that people are able to speak to it. But I would say not, because I know for a fact, because I've had members ask why they can't come and speak to it. And they want to speak directly to the nutrition and why this government is not providing schools the opportunity to have those funds to be able to provide those nutrition programs. Right now, what schools are having to do is they're having to take it out of their overall budget. And this government has said, well, we've given them enough money, they just need to figure out how to manage it. Well, what's happening is teachers or schools are having to make hard decisions. And a hard decision is, for them, it's an easy decision, is to feed kids. But that also means taking money from somewhere else. And we've seen that with less supports in the classroom. We're now seeing K-3 with more than 20 students in a class. And I know the member from Lac du Bonny was a teacher, and he would know that, younger children need more supports. And, having 27 kids or 24 kids in a classroom from K-3 is not conducive to their learning. They need more supports. And, this government has a responsibility, and I know that, leaders have spoken on this. School leaders have said that they need more supports. And, the member from Transcona, with his expertise and, his experience being a teacher, being a principal, administrator, speaking with other administrators in other schools, knows how important it is to, make sure that children are getting the nutrition that they need. And I just want to go, talk about a little bit about the former Premier, Brian Pallister, and how this government is continuing that same agenda. The former Premier, he had said that if children are going to school hungry, then parents aren't fulfilling their responsibilities. Well, Deputy Speaker, families are doing the best that they can with what they have. And, people that are on EIA or that are, working minimum wage jobs, working 2-3 jobs, some of them, because they're single parents. They have to pay daycare. And daycare, is not cheap in this province. And, this government hasn't been supporting parents in the way that they should be supported. We have a long, wait list for parents. And these parents are struggling. They're struggling to, send a lunch to school for their children. And that deters parents from maybe sending their kids to school. I just had a conversation yesterday with Sal Burrows, who does a lot of great work in Manitoba, but a lot in Point Douglas. And we were talking about absenteeism and how nothing's been done about making sure kids are going to school. And I know as an educator that certainly I've done my best to make sure I had a fridge in my classroom that and I know there's lots of teachers that are doing this out of their own pockets, providing snacks to kids, providing breakfast. And this government, needs to step up to the plate. They need to listen to the community leaders. They need to listen to the Child Nutrition Council. And they certainly need to be attuned to what's going on in the community and what the needs are of people who are struggling. So I say to this government, this is a good bill to support. They should be reporting on this so that they can see where the challenges are and how they can better support families. So with that, miigwech.
On House business, the Honourable Member for Concordia.
Thank you very much, Mr. Deputy Speaker. Pursuant to Rule 33.8, I'm announcing that the private member's resolution to be considered on the next Thursday of private members' business will be the one put forward by the Honourable Member for Point Douglas. The title of the resolution is Calling on the Provincial Government to Immediately Increase the Minimum Wage to $15 an hour.
It has been announced by the Honourable Member for Concordia pursuant to Rule 33, subsection 8, that the private member's resolution to be considered on the next Thursday of private members' business will be the one put forward by the Honourable Member for Point Douglas. The title of the resolution is Calling on the Provincial Government to Immediately Increase Minimum Wage to $15 an hour. The Honourable Minister of Mental Health and Community Wellness.
Thank you, Mr. Deputy Speaker. I will have some brief remarks to put onto the record in support of child nutrition within schools. I was happy to meet with Wendy Bloomfield, who is the chair of the Child Nutrition Council of Manitoba last month in April, along with Samantha Turen, who is the vice chair of this organization. And I would also like to thank them for their dedication to school nourishment, which supports the development and learning of children in Manitoba. Our government is providing $1.3 million from this year's budget to the Northern Healthy Foods Initiative to assist in the development of programs driven by northern communities that develop resources, opportunities, and education around local food systems. The Frontier School Division's Grow North program is a part of this initiative, as is Canadian Child Nutrition Council of Manitoba. We also last year, Mr. Deputy Speaker, had increased the budget for Child Nutrition Council of Manitoba by $200,000 in order to provide more funding to school nourishment programs, and so that they could provide more food to children throughout the province. Mr. Deputy Speaker, our government has continually invested in these very valuable programs to assist families who do struggle with affordability, in addition to other initiatives throughout our budget that really reflect on the struggles that families are facing today. So, Mr. Deputy Speaker, I think that this is an opportunity as well to commend the Child Nutrition Council of Manitoba. They support more than 271 programs, and they reach more than 33,000 students every day. This is information that is readily available to the public. They are happy to report on their programs, their initiatives, and all those who they serve, and we are happy to support that transparency. We've also, as a government, created a provincial task force on poverty and education with intersectoral stakeholders from across Manitoba in order to explore impacts of poverty on education, identify actionable strategies to remove barriers to the participation in learning, and work in connection with the province's poverty reduction strategy. Public engagement is right now underway. So the task force has established a subcommittee on nutrition and food security. I'm very much looking forward to hearing the results of their consultations and recommendations, which I know our government will be eager to implement. Mr. Deputy Speaker, I would like to also indicate that a healthy diet for proper nutrition are necessary for student academic success. We recognize this as a government, and by supporting organizations that provide school nourishment programs, we help to ensure students in Manitoba are able to reach their full potential. And I just want to also indicate that our government has supported Healthy Schools Grants, Project 11, Thrival Kits, and PACS Dreammakers as school-based initiatives which provide health promotion and illness prevention supports for our children and youth during a critical time of their development. And with those few words, Mr. Deputy Speaker, I will sit down and allow others to share their wonderful words.
The Honourable Member for Tyndall Park.
Thank you, Mr. Deputy Speaker, and I'd like to thank the member for Transcona for bringing forward this legislation, because whenever we're given the opportunity to talk about child and nutrition programs within our schools and our education system, it's a good conversation to be having, because it's important we're all aware of it as legislators. Just a couple of weeks ago, I introduced a resolution calling to increase investments to school nutrition programs. And a big part of this resolution for myself was the consultation process. It took a long time. It took about 6 months, Mr. Deputy Speaker, in consulting with many different groups, many different schools, also the Manitoba's Teacher Society and the Child Nutrition Council of Manitoba, Mr. Deputy Speaker. And it does concern me a little bit that the way in which the member introduced this legislation, he was very vague in how and who he consulted. And even when I asked the question, did you consult specifically with CNCM, he said he couldn't remember who he consulted with, but perhaps he did a few weeks ago. And it doesn't provide a lot of confidence in the legislation, Mr. Deputy Speaker. And it's important that when you're introducing legislation, especially here in the province of Manitoba, that it's factual, Mr. Deputy Speaker. We need to make sure that legislation that's going to affect all Manitobans is in fact factual. We owe it to Manitobans to do our diligence in introducing legislation. So a couple of things that I would like to correct and put on the record here, Mr. Deputy Speaker, and I know I'm upsetting the member from Concordia right now, but he'll have an opportunity to speak to this bill as well if he would like, Mr. Deputy Speaker, but right now it's my opportunity. So a couple of things that I would like to correct is just where these meal programs are located. I can wait till the member is finished.
I just remind those members not holding the floor that the Honourable Member for Tyndall Park does have the floor and thereby has the right to speak uninterrupted for the time allotted to that member. So if other members can be respectful and listen, as has been the case for those who have spoken before, that would be much appreciated. The Honourable Member for Tyndall Park.
Thank you, Mr. Deputy Speaker, and if members allow for me to share my words, I will actually wrap up before 11 o'clock, so maybe this legislation will move on towards committee. Mr. Deputy Speaker, a couple of corrections I just want to put on record here is where these meal programs are located. So the member spoke a lot about how they're located in Winnipeg, but the reality is there's 19 programs, CNCM programs, in Interlake Eastern Regional Health Authority, 27 in Northern Regional Health Authority, 75 in Prairie Mountain Health, and 26 in Southern Health. That's in addition to the 131 in Winnipeg. So that's 147 CNCM programs in rural Manitoba, in addition to Winnipeg, Mr. Deputy Speaker. And it's important that that factual information is put on record. The second correction that I want to make, because it's important to debunk this information being put on the record by the member for Transcona, is that meal programs are not only for those who are in poverty. Meal programs are also for those who take the bus in the morning, Mr. Deputy Speaker. And I did hear a little bit from the member from Point Douglas, and I do want to give her credit. She actually did talk a little further to this and added some clarity that meal programs are not just for those who may not necessarily be able to afford food in the morning at home, Mr. Deputy Speaker, but those who take the bus to school in the morning, whether they get on the bus early, whether it's a long commute, whatever the reasoning may be, oftentimes students will get to school with empty bellies and in the need for food. We can talk about morning responsibilities. I remember I shared this example a couple of weeks ago, but during I Love to Read month, I was able to talk with a student and she was telling me all about the responsibilities they have in the morning, helping with chores, helping their sibling with chores, and because of that, they can't always find time, or sometimes they forget to eat before they go to school. And we haven't even talked about extracurricular activities, whether that's track or field. And again, Mr. Deputy Speaker, the member from Union Station and the member from Wolsey, they're really making it difficult for me to be able to focus right now. But
Order, please. This is opposition morning, and I think it's in the best interests of opposition members to facilitate the smooth passage of this opposition private member's bill. Those members who are interrupting debate and talking while another member is talking are not advancing their own interests. I would encourage all members, please, to be respectful and to allow the member for Tyndall Park to speak with a minimum of interruptions. The honourable member for Tyndall Park.
Thank you, Mr. Deputy Speaker. So just a few more words I would like to put on record. Few more words that I would like to put on the record here, Mr. Deputy Speaker. Again, because of poor consultation, it was failed to be mentioned that schools that participate in CNCM programs have to provide receipts for analysis so that CNCM actually knows how these funds are being spent. And this gives the autonomy to schools to determine what programs may be applicable for their schools. An example of this would be with cultural appropriation, Mr. Deputy Speaker. You know, there's a lot of data already made relevant to Manitobans, and we've all been briefed on it as legislators here in this House. And, you know, CNCM currently has 13 schools on a wait list for these programs. And so I'm concerned with the legislation. I'm concerned about who will be doing the work behind the legislation. I know our educators have enough on their plates, and I trust that the member for Transcona is well acquainted with this. He should be familiar with this, all the work that they currently do. And then going through a pandemic and having to adapt the curriculum, Mr. Deputy Speaker, we shouldn't be adding more work to them. So the question of who would be actually implementing and doing these reviews is outstanding. I think what is really needed here in the province of Manitoba is the implementation of investments. Let's invest in these programs and make sure that all students in Manitoba can have access to food in schools for whatever reason that may be. Thank you for allowing me the opportunity to share a few words, Mr. Deputy Speaker.
The honourable member for Borderland.
Thank you, Mr. Thank you, Mr. Deputy Speaker, and I do appreciate the opportunity to speak on this. I think notionally, I think this House does agree. It seems that you know, children should be able to go to school well-fed and that sort of thing. I don't think there's any dispute on that, and frankly, I am quite sympathetic to you know, any supports that we can provide to enable parents and caregivers to ensure that children do go to school with full bellies. But I do think, you know, listening to the debate, it is interesting that the members of the opposition in particular, you know, arguing with one another on this subject, in particular members of the official opposition, the NDP, who appear intent on foregoing any attempts at fostering unity on this issue and perhaps getting this bill through. And I think the debate has been quite useful and raised some concerns, and I think this is a subject that we need to grapple with a little more. Myself coming from a rural area, I think of my years in elementary school and high school, and ran into a former classmate of mine.
Order,
from
please.
high school.
When this matter is again before the House, the honourable member for Borderland will have 8 minutes remaining, the hour being 11. It is now time for private members' resolutions, and today we will consider resolution number 16, calling on the provincial government to invest in public health care nurses, sponsored by the honourable member for Wolseley. The honourable member for Wolseley.
Thank you, Mr. Deputy Speaker. I move, seconded by the member for Union Station, that the Legislative Assembly of Manitoba urge the provincial government to increase investment in public healthcare nurses. I apologize. I'll do this again. I move, seconded by the member for Union Station, therefore be it resolved that the Legislative Assembly of Manitoba urge the provincial government to increase investment in public healthcare nurses rather than private for-profit agencies. Thank you.
It has been moved by the Honourable Member for Wolseley, seconded by the Honourable Member for Union Station, that therefore be it resolved that the Legislative Assembly of Manitoba urge the provincial government to increase investment in public health care nurses rather than private for-profit agencies. The Honourable Member for Wolseley.
Thank you, Mr. Deputy Speaker. This government is using the oldest trick in the book to ruin public health care and then hand contracts to the private sector as a form of solution to the problem that they created. This isn't just happening on a small scale, Mr. Deputy Speaker. Right now, there are 2,400 vacant nursing positions in the province and $40 million a year being spent on private agency nurses. But the answer here isn't complicated. Instead of relying more and more on for-profit companies, the province should just fill the public nursing positions that it is leaving vacant. The PC government clearly wants American-style healthcare, but Manitobans want a strong public healthcare system, something that is accessible and affordable and equitable across this province. This March, Probe Research asked whether Manitobans want the province to hire more healthcare staff through the public system or pay private providers, and a full 68% preferred to invest in the public system. This PMR fully reflects the views of Manitobans. The PC government has created chaos in our public health system beginning long before the pandemic. They closed 3 emergency rooms and an urgent care center. They cut 56 inpatient surgical beds. They cut 18 ICU beds. And in the last 4 years, they have closed 124 beds across Winnipeg. They also fired dozens of healthcare workers. These cuts left us unprepared for a pandemic. Private agency nursing has skyrocketed, and last year, this government spent $40 million. Under the cover of the pandemic, they're privatizing millions of dollars in surgical services to the private sector, yet they haven't replaced the surgical beds they cut in consolidation. The previous health minister gave $8 million to privatize outpatient surgeries with private providers such as Protoclinic, Maple Surgical Center, Cardio One, and Western Surgical. And using the pandemic, the Conservative government quickly prioritized using the pandemic, the Conservative government is quickly privatizing healthcare services. They entered an untendered $4.5 million contract with Morneau Shepell for virtual mental health services at a time when hundreds of local mental health care workers were laid off during the pandemic. They outsourced $16 million in COVID screening and sequencing to DynaCare. They outsourced contract tracing to a virtual call center, 24/7 InTouch, leading to many Manitobans receiving misinformation about isolating and quarantine requirements. Current contracts for all services total over $50 million. The PC government cut 50 health jobs in the midst of a pandemic, saying it was essential that health regions meet their budgets. But at the very same time, they contracted management of vaccine distribution to private companies, whose recruitment efforts were referred to as a gong show by nurses. It should not be surprising. The PC government has spent years cutting and defunding public health care while contracting out and privatizing health services. In 2017, they defunded outpatient physiotherapy and occupational therapy services in Winnipeg, resulting in over 20 people losing their jobs and thousands of patients to pay out of pocket for the service. We are now the only major health region in Canada that doesn't have some kind of public option for these services. They handed over $15 million in contracts for private home care companies with no evidence whether the private contracts delivered on value or quality. They're opening the door to private for-profit diagnostic services for EKGs.
Order, please.
And
could both sides listen to the debate, take conversations to the loge or the hallway or wherever, but when we're sitting here, we should be listening, we should be paying attention. If the chatter could go down a few levels, that would be much appreciated, I think, for all concerned. The Honourable Member for Wolseley.
Thank you, Mr. Deputy Speaker. I appreciate that when we're in here, colleagues are doing other work and talking about other important matters, but it can get kind of loud at times, so I appreciate you mentioning that. They're opening the door to private for-profit diagnostic services for EKGs and ultrasounds at Protoclinic, which the federal health minister says should be covered by provincial and territorial plans. But Protoclinic continues to advertise its diagnostic services without a provincial license. And when pressed, the former health minister had said of his government was open to privatizing MRIs and other diagnostic testing. And their plans include privatized lab services and diagnostic imaging. We're not alone over here in our criticism of the PC government. The federal government ordered the PC government to comply with the Canada Health Act by prohibiting private diagnostic services and addressing private nurse practitioners charging for services normally covered under our provincial health plan. And the PCs still have not resolved this. Their failure to comply could cost Manitobans millions of dollars. We know where the PC government is headed next, applying a health premium, also known as a health tax. This is something they've already tried to implement. Manitobans are clear, Mr. Deputy Speaker. Healthcare should be universal and affordable. They don't want two-tiered American-style healthcare. Healthcare is a matter of life and death for all of us, for everyone in this chambers, for everyone in this province, and no one should pay additional taxes or fees to access the care they need. The PC government will be quick to claim that the only reason that they're hiring private nurses is because of the pandemic, but in fact, they laid the groundwork for privatization long before the pandemic made further cuts to our healthcare system. They've been making cuts since they took office. The PC government cut healthcare right before the pandemic. Health funding for 2018-2019 was underspent by $215 million. Budget 2019-2020 cut funding for healthcare by $120 million. In 2021, funding for long-term care was well below the rate of inflation, and this after the terrible events during COVID in our personal care homes. Budget 21-22 included funding cuts of $13 million for acute care services delivered through regional health authorities. That means less care by the bedsides, and we see the results of their cuts throughout the health system. The PC government left our hospitals unprepared for a pandemic, and Winnipeg ran out of ICU beds, and it's no wonder. Critical care at Grace Hospital has a vacancy rate for nurses of 26%. Critical care at HSC has a vacancy rate for nurses of 31%. And emergency care at St. Boniface Hospital had a vacancy rate for nurses of 28%. The PCs are still forcing cuts on hospitals, including $2.8 million cut for vacancy management at Prairie Region, $2.2 million in efficiencies cut at Southern Health, $516,000 for streamlining and efficiencies at Interlake, and $2.3 million in Northern Health to downgrade standard of care in PCH and elimination of subsidies for patients who have to travel within the region for care. And the situation has continued to deteriorate in Winnipeg as well. ER wait times are the highest we've seen in a decade. This PC government is completely out of touch. After cutting 75 nurses at Red River, 1 year later, they told the media, Manitoba needs more nurses. Wonder why. They also just finished closing the doors to another primary care clinic, St. Boniface Family Medical Center, after closing the Corridon Clinic and Quick Care clinics. They have pushed the consolidation of Dynacare clinics, resulting in longer waits for simple diagnostic tests like blood work. 26 of 53 diagnostic labs closed, replaced by 4 super sites, making it harder for Manitobans to access the care they need. And we know that paramedic service has been begging the province for funds for more ambulances, as there has not been a net new ambulance in many years. The The PC's government's consolidation of neurology services led to the departure of many neurologists and a 36% vacancy rate. I've spoken in here before of many children waiting for neurological care, including surgery and including a child in my constituency. They closed cancer care sites at Concordia and Seven Oaks and canceled intravenous therapies at Transcona Access Centre. They've run rural healthcare into the ground, forcing emergency rooms closed at Roblin and Grandview for months. We will fix the PC government's mistakes and the crisis they have created in the healthcare system, and we will do this by repairing the relationship with frontline workers. And today, we call on this government to once again invest in publicly funded nurses in our public healthcare system. Thank you very much, Mr. Deputy Speaker.
A question period of up to 10 minutes will be held, and questions may be addressed in the following sequence. The first question may be asked by a member from another party. Any subsequent questions must follow a rotation between parties. Each independent member may ask one question, and no question or answer shall exceed 45 seconds. The Honourable Member for Radisson.
Thank you, Mr. Deputy Speaker, and I thank the member for bringing forward this topic. I think it is it's something that deserves discussion. Certainly, I know I have a great deal of appreciation for the work of nurses, especially in our healthcare system, and I'm ever so grateful for them, regardless if they're showing up at my bedside as an agency nurse or a public health nurse. I'm not sure I could tell the difference actually, but as a patient, certainly. But I would just ask the member, are there jurisdictions in Canada that don't use agency nursing at all? Are you aware of any?
The member for Wolseley.
I thank the member for that question, and I can't give you an answer on that. I apologize. The healthcare is a very, very important issue to myself and to my constituents, and this issue of private funding is very important. But as I'm not the critic in this area, I don't have a broader scope of some of those decisions across the country.
The member for Union Station.
I'd like to thank my colleague, the member for Wolseley, for bringing this really important motion forward. I know she's been advocating tirelessly on behalf of her constituents who've been affected by this government's cuts to healthcare and the way that they've mistreated nurses and healthcare professionals since 2016. I'm wondering if the member could provide her thoughts on the fact that the Premier has stated that investing in nurses, and I quote, regardless of public or private, is their plan. Does that comment give the member any confidence that the Premier actually appreciates or even understands the importance of a public healthcare system?
The member for Wolseley.
I thank the member from Union Station for that question. And no, that quote did not give me any confidence when it was said, and it certainly doesn't give me any confidence now. I think that, it's really unfortunate when folks who have no barriers, no financial barriers in their lives are making decisions for people who have so many barriers and can be so casual about private versus public and what's provided. And it deeply disturbs me that this government does not understand the significant impact on most Manitobans of this careless decision-making.
The Honourable Member for River Heights.
Mr. Deputy Speaker, my question to the member, I wonder if the member would help us understand why there are so many vacant positions, so many vacant nursing positions, including in such drastic areas or areas of drastic need like emergency rooms.
The member for Wolseley.
Thank you, Mr. Deputy Speaker. I think there's multifaceted reasons for this. Absolutely, the starting point is that this government cut positions. They cut positions. They came into government and said, we just don't need as many nurses in this province. Then we've added on to that the factor of having a pandemic and the burnout that's happened, the people being asked to do so much more with less. Nurses, longtime nurses leaving their profession, taking early retirement, or going into completely other professions to protect their own mental health and sanity. And so this is just continually added to the chaos. Nurses have not been listened to. They were without a contract for a long time. And so
the member's time has expired. The honourable member for Dauphin.
Thank you, Mr. Deputy Speaker. I would just like to say this BC government, I know, supports all nurses. We don't like the picking and choosing and wedge issues that are going on here. We invested in nearly 1,600 nursing training seats. We've graduated 15% more nurses. We're internationally educated nurse applicants are able to obtain the license and start practicing in Manitoba with up to $23,000 in financial aid. We've added 60 new full-time nurse positions in ICUs to Brandon Grace Hospital, St. Boniface, and Health Science Center. So I would like to know, can the member advise on why they are against agency nurses when the president of the MNU and
the member's time has expired. The member for Wolseley.
Thank you, Mr. Deputy Speaker. I think this is an interesting spin on the facts and on what I've said. The folks who serve as agency nurses are good people and maybe good nurses as well. This isn't about that. This isn't about a split between, this is about a value of a public healthcare system. This is about saying this is where the dollars are going to go, that we're not going to rely on, throwing millions, $40 million or more towards a private system, a for-profit system, when we can be investing in a public system and making it stronger and ensuring we have the health care that people need when they need it.
The member for Union Station.
Thank you, Mr. Deputy Speaker. I'm wondering if the member, I'm just inspired by the member for Dauphin's question, and so I'm wondering if the member for Wolseley could provide her own thoughts on the fact that this government has been mistreating nurses since 2016, has made their working conditions so unbearable and in some cases traumatic that nurses have been forced to leave the public system into private work for private agencies just to maintain some semblance of balance in their lives. And I'm wondering if the member for Wolseley could talk a bit about why the government's mistreatment of nurses has had this kind of an impact and what she's heard from professionals that she knows in her community.
The member for Wolseley.
Thank you, Mr. Deputy Speaker. There's been a lot of traumatic stories coming out of the healthcare system, and those aren't just from patients. There's a lot of nurses that have literally experienced trauma in their lives. When we hear the stories of, their fear of walking through a hallway and even making eye contact with some of the folks experiencing hallway medicine because they simply can't meet the need, and it's so painful to, I had a constituent who was kept near the nursing station for weeks in his bed in the hallway because his condition was so serious they had to keep an eye on him. But the poor man was in a public setting with his broken hip where he couldn't get out of bed, and that was traumatic for the nurses serving.
The member's time has expired. The member for Brandon East.
Thank you very much, Mr. Deputy Speaker. And I do want to thank the member for bringing this resolution to the floor to give us an opportunity to have a conversation about it and hear different views, because hearing other views are very important for all of us in bringing forth legislation. And I know one of the most famous questions we always talk about on resolutions is consultation. And I know even last night I was back in Brandon for an event and I sat with some nurses at the table and I was able to communicate and listen to them as well. So I'm just wondering if I could ask the member if she could share with the House on the consultation process, who she consulted with and how long that consultation process was.
The member for Wolseley.
Thank you, Mr. Deputy Speaker. This PMR is really a group project from our side of the House. Our health critic has spent hours and hours talking to, consulting with nurses throughout the pandemic, certainly certainly closer to this PMR more recently. But each of us has nurses in our constituency. Each of us talks to, not just nurses, I've talked to paramedics who've been called in to do the job of nurses, who've talked to me about the trauma and the stress of that situation. We have done extensive consultation on this issue. I think every member of this house of this side of the house has had those conversations with nurses.
The member's time has expired. The member for Union Station.
Thank you, Mr. Deputy Speaker. I just want to thank the member for Wolseley for her thoughtfulness in her responses and for doing what I know she does so well, which is centering the folks who are really impacted by this government's terrible decision-making in healthcare. I'd like to ask the member if she thinks that more broadly, we've seen several ministers of health during this pandemic, different ministers of health made decisions to cut healthcare leading up to the pandemic. I'm just wondering, does this member think that the government as a whole, understands the difference between private and public health care and the impacts that has?
The member for Wolseley.
Thank you, Mr. Deputy Speaker. Well, the easy and quick and accurate answer is no, they don't understand the difference, clearly. But maybe that's letting them off the hook. Maybe they actually do understand the difference, and it's more important to them to save a little money over here in the public system while they filter those dollars into the private healthcare system, help out some friends who own some businesses, because we see that all over the place, and to really just create chaos, to move towards a vision of a privatized system where the government simply doesn't take responsibility for the people of the province. So maybe they do know the difference, Mr. Deputy Speaker.
Time for questions has expired. The floor is now open for debate. The member for Radisson.
Thank you so much, Mr. Acting Deputy Speaker. Appreciate the opportunity to speak on this resolution. I came in this morning assuming that the topic that we'd be focused on was nurses and nursing. The member who brought forward the resolution has gone to all sorts of different places in her remarks. Perhaps I will take some of those same liberties as I do my remarks and talk about some of the other aspects of our healthcare system. But I just want to start by expressing my gratitude for what nurses do in our system. I know it's a difficult job, it's a challenging job, and I have a great level of admiration for the people who choose that career and who dedicate their lives to serving patient needs in our hospital system, in our walk-in clinics, wherever else they may be finding employment through home care, and in a variety of clinics across the city and a variety of hospitals. Now, I've actually spoken with several nurses, I would say actually well over a dozen nurses, just in the last few months, and a lot of soon-to-be nurse graduates as well, about what they think about our healthcare system, what improvements they think could be made, and what would also encourage them to take work here, to want to continue to work here in Manitoba, not to leave our jurisdiction, right? To try to get, I was trying to get at some of the root causes of the challenges that Manitoba historically has had. This is not a partisan comment at all, but historically Manitoba has had challenges in both recruiting and retaining nursing staff, and this is something that you get a number of different opinions, but you do pick up on some themes, and so I was very pleased to have those kind of conversations. I can say that the current subject of private versus public is not one of the themes that the nurses brought forward, nursing students brought forward to me, in terms of what would make them want to stay in Manitoba versus leave. Instead, they're more focused on things like ensuring that they have a work environment that's a manageable work-life balance, that they have technology at their fingertips that enables them to do their work efficiently and effectively, and to really exercise their full scope of practice. These are things that nursing students have spoken to me about. And when I talk about technology, whether that's at the bedside or a couple other examples, I think the member opposite mentioned Dynacare clinics. She seemed to somehow be frustrated that we've got this, certainly in my constituency, I have a large new Dynacare clinic. It is performing very well. It's been given very high levels of appreciation by my constituents, by the citizens who live there, compared to some of the much smaller clinics and the difficulties that those smaller clinics posed. And I just, as I was here, this is the wonders of technology. I've got Wi-Fi in here. I could go to dynacare.ca and I could check what the wait time was at the clinic in my area. It was 0 minutes. 0 minutes. They are able to take somebody for a walk-in appointment right now in my constituency. So I thought, well, that's not fair just to look at one walk-in clinic in the city. Let's take a look at some of the other some of the other Dynacare labs. So I looked at a number of the other ones. There was 10 minutes wait. There was 0 minutes wait at a number of other places. I think I saw one that was 21 minutes. But by and large, there were no significant waits for Dynacare lab services. So that's a good thing. I understand why the opposition doesn't want to talk about that. They only want to talk about things that they think reflect poorly. And I could appreciate that might be their job as government, or as opposition. So my job as government is to talk about things that I think we're doing well. So Dynacare labs are functioning well, and the new large Dynacare lab that's opened in my constituency, that's easily accessible through transit, has a decent parking lot, has the ability to make appointments. I haven't seen big lineups of people waiting outside that lab like I did with the older, smaller labs frequently in my first couple of years as an MLA. So happy with that. But then turning to walk-in clinics as an example. So some of you might not be aware, but there's a website called medimap.ca. It's very helpful. Not all walk-in clinics, but many walk-in clinics are registered on there, and they keep their wait times up to date, and they also even offer online check-in services. And so today I decided I would check, in my constituency, what were the wait times for some of those clinics. And well, maybe I can give it to you live here. It looks like a 10-minute wait time at Regent West Medical Center walk-in clinic. No wait at all at Mid-City Medical Center and walk-in clinic on Marion. A 15-minute wait time, Prana Family Medical Center in downtown Transcona. No wait time at all at the Norwood Walk-in and Family Medical Clinic. No wait at all at the Eaton Place Medical Clinic just right downtown here at 333 St. Mary. So, and this is the kind of convenience that being able to access this kind of information online is very convenient. Now, I hear the members opposite chirping about that doesn't necessarily serve somebody who maybe doesn't have internet access. I can appreciate that. Certainly, it's a service that I offer at my office, is that if a senior wants to call my office, my constituency assistant is happy to point out to them which clinic, or even to make an appointment on their behalf. So I'm not sure what's bothering the members opposite. Any enlightenment from my colleagues? I can't seem to.
Order! It's getting a little bit loud in here. I would ask the members to allow the member who has the floor to continue with his speech, so they would offer the members across the way the courtesy of the same. The member for Radisson.
I'm not denying that certainly in some contexts in our healthcare system right now, wait times are a challenge, and we've read about that in our newspapers. We've heard about that on the news. We've talked about it in this House. It's a significant challenge, and it's not one that I'm attempting to minimize in any way. But when it comes to some of these other services, Dynacare clinics, the walk-in medical clinics, they're performing well, and the wait times are very much reasonable. So that's something that I'm quite pleased with, and I should be pleased with. Now, when it comes to the resolution that we're discussing today, the resolution that we're talking about today is about nurses. And I think I've already expressed great appreciation for the work of nurses. Certainly, I very much appreciate meeting nurses when I'm out knocking on doors. And I've met quite a number in my years of campaigning. And I go back to them. They know who I am, I know who they are, and I ask them for their input and advice on a regular basis. And I appreciate the collegial and the cordial discussions that we can have. We have discussions that result in positive feedback, ways that we can make our system better, and that's certainly what I'm committed to doing as a legislator, as an MLA here, and that would go for, I hope, the members opposite as well. And I'll give all confidence to the To the member for Wolseley, I do believe that she's genuine in her concerns, and that she too advocates for a better healthcare system. So I appreciate that. I think we can both agree that we both want that. We want what's best for Manitobans. We want people to be able to receive the care that they need close to home. We want people to be able to receive the care that they need when they need it. That's our goal, and that's a goal we share. And so what we need to do is we need to look at ways that we can accomplish that. And what I would suggest to the member is that the results are what matter. The results are what matter. So if we're able to deliver care through a public system that's publicly funded with public health nurses, I'm very happy about that, and I want to keep that going. If there's private partners that come alongside, as they have for decades in this province, because almost every doctor's office is a private clinic by definition, and we certainly have medical clinics, the DynaCare labs that I referenced earlier, walk-in medical clinics. We have a variety of these partners that aren't necessarily directly funded by the public system, but are contracted by the public system to provide services and go under a fee schedule. They're part of our healthcare system, and the same thing goes for agency nurses. I think about what the MNU president Darlene Jackson had to say about nurses, and in fact about agency nurses, and in fact what some of the nurses that I've spoken with is they're grateful for the help. If they have to choose between running a shift short-staffed or getting an agency nurse to help them, they say please and thank you for the agency nurse. That's the reality of the situation. And you know what? Right now the NDP are trying to make hay, but they're not being honest to their own record. The fact of the matter is that agency nurses were in existence when they were in government as well. And they were used actually in increasing proportion, 2010, 2011, 2012, 2013, 2014, 2015. Over that time, the amount that the NDP government was spending on agency nurses, I believe it doubled over that time. And it's a total of $46 million over those 6 years. That's not a criticism, not a criticism. What that is an observation of fact. And that's where I would encourage the members opposite to take a healthier view to our shared goals. We all should want, I hope, better care for Manitobans. And we should all want our nurses to be respected and treated well in our system. We should all want them to want to work here in Manitoba. That's my goal. I hope it's the goal for the member for Wolseley. And I thank you very much for your time today.
The member for Union Station.
Mr. Deputy Speaker, I am thrilled to put some words on the record in regards to this motion brought forward by my colleague, the member for Wolseley. I am blown away by the comments the member for Radisson that he just put on the record. I am really and truly, Mr. Deputy Speaker, oh my goodness. I mean, really and truly, he essentially just exemplified what is wrong with this government, why their approach is so reckless and harmful and without reason and research, without awareness of what's going on in our healthcare system, without an appreciation for who it impacts and how and why. I'm not even quite sure where to begin, Mr. Deputy Speaker, but I guess I'll start with his comments about DynaCare. This member stood up and with arrogance, in all of his privilege, actually went onto his computer using internet provided to us by the legislature, or maybe he toggled it off of his phone. But that was his starting point in talking about the privatization of labs by DynaCare. With DynaCare in our province, he actually did something that thousands of Manitobans don't have the resources to do. That's how he talked about this particular issue. From a place of incredible privilege, on his phone, talking about all the different locations that he could just hop into his car, drive his vehicle to go to when gas is almost $2 a liter, and pick and choose what locations at the city he can afford to spend the time to go and wait and get lab work done. When, Mr. Deputy Speaker, there are countless Manitobans who don't have the luxury or the privilege of being able to do so, who wouldn't have been able to start where he started on his laptop to get the information, who can't, for a wide range of reasons he clearly doesn't care about, stand in line, out in the cold or in the rain or without support and wait to get lab work done. Mr. Deputy Speaker, that was an embarrassing display of how out of touch not only that member is, but unfortunately many members, more broadly their caucuses, with how their decision-making affects Manitobans. Really and truly, I mean, I'm not sure what he thought he was doing with that, but he certainly did not have the impact I think he intended to. All he did was remind many Manitobans of how much they miss their local labs, where they used to be able to, as I did, Mr. Deputy Speaker, I was able to see my doctor, get lab work in the same building. If I needed a dentist appointment, I could literally walk across the street and do the same thing. In the west end of Winnipeg, Mr. Deputy Speaker, many people, low-income folks in the community could do the same. They used to be able to do the same until this government privatized that aspect of healthcare, and now those very same people in this very community called Union Station, after they see their primary care providers, if they're able to find one, because under this government that has been significantly delayed, have to find the resources to take the bus or maybe walk for quite some time, take a cab if they can afford it, because many of them don't have the luxuries that this member just put on the record to figure out where to go to get their lab work done now and make the arrangements to do so. Childcare in place, make sure they're physically able to do so, etc. So I guess that's where I'll start. Mr. Deputy Speaker, the member, his last remarks were that it's the results that matter. Again, I can't even capture in these short few minutes that I have how incredibly out of touch that member from Radisson's remarks are. So let me just remind that member and members opposite of the results we're seeing right now in our healthcare system as a direct result of their agenda to privatize healthcare, to create a for-profit, two-tiered American-style healthcare system here in Manitoba. We have the longest wait times we've ever seen in emergency rooms. We have people waiting longer than they've ever had to access a bed from the ER to another part of the hospital, Mr. Deputy Speaker. We have had Manitobans have devastating outcomes in hallways due to their generation of hallway medicine in Manitoba due to their cuts. It is ridiculous, Mr. Deputy Speaker, that the member would stand up and actually state it's the results that matter, as if we're not seeing the results right now of their decision making. They forced international students into a for-profit healthcare system. How many international students have we heard of who have had devastating healthcare outcomes because they haven't been able to access healthcare because they don't have coverage through their private providers? They've been denied coverage because they go to emergency rooms and they're being told, well, actually, you've got to pay up front. I'm sure the member, if he actually listened to those students, would be aware that there are international students who can't access prenatal health care because they're being told they have to pay up front because they don't have access to the public healthcare system, which is what we're talking about, that we need nurses in our public healthcare system. Not forcing nurses by way of mistreatment and terrible conditions, deliberate underfunding and cuts, to take jobs with private agencies where they can actually not be mandated to work for, in some cases, weeks in a row, consistently double shifts. The member for Radisson doesn't have a clue the impacts that his government's decision-making has had on nurses. If he did, he wouldn't stand up in this House and minimize what's happening in our healthcare system right now as a result of this government prioritizing the privatization of nursing in Manitoba. Nobody on this side of the House would ever be critical of the nurses working for private agencies. Those are good nurses. Those are nurses with great skills. What we're saying is that this government needs to invest in public health care and stop deliberately mistreating and disrespecting public health care and the nurses who work within it, to the point where they flee the public health care system under this government to try to find some reprieve. And Mr. Deputy Speaker, I've said this before in the House, I'm going to say this again.
It is incredibly disingenuous and deeply insulting for members opposite, including the member for Radisson today, to twist the words of nurses and healthcare professionals who, yes, have thanked and been grateful for support in the healthcare system from other nurses, wherever they come from, to twist their words as some sort of endorsement for private nursing. Nurses and our colleagues, they're collegial, they are going to lift one another up and be grateful when other nurses step up to provide the support that they need. For this member to stand up in the House, and other members across have done it, even the Premier has done it, to twist their collegiality, to twist their words, and to somehow imply that that's an endorsement for defunding the public healthcare system, as this government continues to do, is wrong. It is absolutely wrong. Nurses in our public healthcare system are drowning. They are desperate for support. They are desperate for resources. It is disturbing to hear members opposite stand up in this House and minimize the realities of that. I really don't know at this point, Mr. Deputy Speaker, how much more they need to hear in terms of what nurses in our public healthcare system are dealing with. And this notion, this attitude from the members opposite, that somehow privatizing healthcare or investing only in private nurses, making that the priority above investing in public nurses and public healthcare is actually some sort of reasonable decision-making, is ridiculous. If these folks had done 15 minutes worth of research on a beautiful piece of technology and innovation called Google, they would know there is clear, resounding, overwhelming evidence and research and data that definitively shows that private, two-tiered, for-profit healthcare hurts communities, hurts populations. The priority must always be investing in bolstering public healthcare first and foremost. That is where you see the best healthcare outcomes. That is where you see the best outcomes and levels of morale for your healthcare workers. So this government that's been in government since 2016 might want to actually start acting like a government that has been in power since 2016, be accountable to their own decision-making, reflect on how their decision-making affects nurses in the public healthcare system, Manitobans more broadly across the board, and recognize that as much as the member for Fort Richmond wants to point fingers, I can hear her as she's heckling me, point fingers at decisions decades past, that she has been a part of this government as they've made terrible decisions in our healthcare system. She has to live with the consequences of that and needs to face Manitobans and be accountable to that.
The member's time. The honourable member for River Heights.
Thank you, Mr. Deputy Speaker. This resolution calls on the government to increase the investment in public healthcare nurses rather than private for-profit agencies. We support this resolution. The current sad state of affairs in healthcare in Manitoba is untenable. Rates of unfilled nursing positions are extremely high. As the Manitoba Liberal leader, the MLA for St. Boniface, pointed out on March the 9th when he tabled a FIPA report, the Southern Health Region has been operating with 584 vacant nursing positions out of 2,448 positions. Almost a quarter of the positions were vacant. Some, such as the Portage Hospital, which had a 45% vacancy rate for LPNs, are even higher than this already very high, almost 25% rate. Similar situations are occurring in other healthcare regions, with currently 2,400 vacancies province-wide. Sadly, this includes areas of drastic and critical need, like emergency and urgent care centers. Running a healthcare system with only 75% of staff in the middle of a pandemic, or even now when the pandemic is still there but decreasing, is ludicrous. It shows, as much as any other single thing that the PC government has done, that it is incompetent when it comes to managing health care in Manitoba. Private sector businesses would not run for months or years at 75% staffing when they need a full staff. The government should be an example of strong operational capability instead of an example of how to manage and function poorly. How could this situation have happened? Instead of filling regular public sector staffing positions, which are vacant, the government has been hiring more and more agency nurses. This is not to say that all agency nurses or many agency nurses are bad nurses. Indeed, I know of some very fine nurses who are working for agencies and who are making a major contribution to the health care of Manitoba. Indeed, we thank the agencies and the agency nurses for doing their best to cover up for the mistakes of an incompetent government. There are multiple problems which arise from this over-reliance on agency nurses rather than properly staffing regular nursing positions. As an example, in long-term care homes, agency nurses are less familiar with the residents of the care home. They're less able to ensure their needs are well met. Residents who may have some level of cognitive difficulties need to have familiar faces around them. And when there's a constantly rotating agency nurses, that's not present. It helps in these circumstances to have a nurse who's familiar with the people who are being cared for. And there are many other circumstances in healthcare where this applies, but it applies particularly in long-term care. Relying on agency nurses is more costly. Agencies charge for the cost of the nurse, an additional overhead administrative charge. And if there's travel involved to a location outside of Winnipeg or the home location of the agency, then there may be a travel cost as well. These costs add up. They add up to a higher cost, lower quality healthcare system. And that is a legacy of this government. Ensuring all vacant positions are filled promptly decreases the need for overtime, both regular and mandatory overtime. Having to have nurses work overtime, particularly on a mandatory basis, is a very bad practice. Having a nurse work a second shift after having already worked one shift means the nurse is tired, starting the shift in circumstances where the nurse may be working under additional fatigue and stress conditions when we know that mistakes are more likely. There has been a lot of work, particularly, for example, with interns and residents, to recognize the fatigue and stress and burnout and mistakes which happen when people are overworked or worked overly long hours. It's my time to recognize that this also applies par excellence for nurses. It's much more difficult for family life and for scheduling time outside of work when a nurse cannot know ahead of time that she or he will be working. It is very disruptive to good work-life balance, a balance which is really, really important to achieve. There are many more reasons why it's bad policy to delay or stall in filling staff positions. But I think my point is made. Nursing positions and allied health vacancies need to be filled promptly instead of the dawdling of the current government. There appear to be many reasons for the government's inability to fill vacancies quickly. Number one, they haven't made it a priority. Two, in frequently mandating overtime, they've created conditions where many nurses don't want to work, and they've left the profession or gone to work with private agencies where they can have a better work-life balance. Too many nurses have been burned out by the working conditions and lack of respect under this government. It is a sad and sorry testament to the mistreatment of some of the people who are so important to us and to our healthcare system that this has happened. In introducing Bill 28, the so-called Public Sector Sustainability Act, which drastically limited the bargaining power of unions in Manitoba, the government created an environment where many were angry and upset that they as nurses were not being well supported and that their democratic rights were being taken away. Many people don't want to work in the negative environment created by this government. We heard earlier this week from Darlene Jackson, who presented on Bill 2, bill which finally is repealing Bill 28. She said the incompetence of the government in filling nursing staffing positions has meant almost 1 million hours of overtime last year. She talked a lot of the loss of trust in the operational capabilities of the PC government. She talked of the hundreds of nurses who've left public sector nursing because of the Public Sector Sustainability Act. The bill was particularly nasty. Interfering with the collective bargaining, as the government did, has left a sour taste among nurses, and it won't be easily restored. I've commented elsewhere that when the government runs or operates activities like healthcare, it needs to do it very well. For a government to do so poorly in operating healthcare has resulted in a great loss of confidence in the present government. Mr. Deputy Speaker, we support this resolution. Fulfilling the request of this resolution would be a step in improving the government's operating capability in healthcare and would help give Manitoba a more sustainable healthcare system and would give some healing and improvement to a system which was in difficulty even before the Pallister-Stephenson government was first elected in 2016, and such difficulties continue and in fact are worse today. Now, the MLA for Dauphin talked of the government creating a few more nursing positions in a few locations. But if the positions are not filled, if they are vacant, this is an empty, vacant promise. Nurses need respect. Vacancies need to be filled if healthcare is to operate as it should be in Manitoba. Thank you. Merci. Miigwech.
The member for Brandon East.
Well, thank you very much, Mr. Deputy Speaker, and it certainly is a pleasure to rise in the House and speak on something that I'm passionate about, and that is healthcare and the state of healthcare in our province. And again, I said earlier when I was asking a question, and I'll say it again, I thank the member for bringing this resolution forward. We really need to have the discussion, and we need to hear the views of others. We need to understand what happened in the past, what is happening now, so that plans can be made for moving forward into the future. And I know there's lots of talk about spending money on agency nurses, and that's not new. In my previous life, one of the responsibilities I had, Mr. Deputy Speaker, was to provide accommodations for nurses that were coming in to Brandon. In the nurses' residence, we had a number of rooms that we set aside for them. And, so I'm familiar with their roles and their responsibilities. And when I mentioned earlier about the consultation process, the reason I asked that question is because I have been asking that questions of my friends who are still in the business, or again, even last night, a new nurse that I met that I had not met before that is in the Prairie Mountain Health System, to ask the question about agency nurses. Right now, we need to kind of just take the agency nurse dialogue and just set it off momentarily to the side and understand why we have agency nurses. When we look at the nurses, and I'll give it to the member's office opposite who have mentioned this many times, the overtime rates, the extra hours that are being put into nursing, the amazing work that is happening in our front line with our nurses, and the stress on them for having an environment of employment where we need more nurses. I have not met one single nurse that does not care about patients. They're in it for a reason. They're in it because they want to make a difference in the community. They have a passion for helping others. And they are in a spot where they are getting tired, especially the last 2 years of COVID. The extra time that they have to put in, they need a break. They want to take the breaks that they need, but they also want to ensure that healthcare is there for everyone that needs it. I know there are a number of nurses working in the public system that appreciate the assistance of agency nurses. And again, it almost makes it sound in here when we're debating these things that agency nurses is something new, but it's not. I communicate on a regular basis, and I know it is different in the south of the border. It is different. But a lot of the traveling nurses in the U.S., which are an equivalent to our agency nurses, they enjoy a different lifestyle. They will travel the country. They will purchase RVs, and they'll live in their RVs full time as they travel from Alaska to Florida and all over the place, providing services as a traveling nurse. Again, ours is a little different up here in agency nurses because we have provincial jurisdictions. But it's going to cost money, and I believe the opposition are well aware of the money that it costs for agency nurses. Because I do want to go back 2010. We look at who was in power in 2010, Mr. Deputy Speaker. $4 million spent on agency nurses. 2011, $6.5 million on agency nurses. 2012, $6 million on agency nurses. 2013, $8 million. 2014, $11 million. And in their previous government's last year, 2015, another $11 million. So $46,977,618 total spending on agency nurses. Why would they spend that kind of money on it? Because there was a need. And that need was even there before COVID. So 2 years of going through COVID has certainly made the situation even more dire, more of a need. So I just want to make sure that we don't rise in this House and condemn agency nurses. Agency nurses are filling a void that we have in our system because of staff nursing shortages. And we are addressing that, and I don't argue that with the opposition. We are addressing that. We have a budget that we have put out that is spending, as we've heard a number of times today, $7.2 billion on health. So here we have, I'm not going to say an overnight solution, Mr. Deputy Speaker, but we do have solutions that we can work on to work in collaboration with our opposition, with their support, with the nursing unions, with the colleges, with the regional health authorities and shared health, to ensure that we have an opportunity to fill these public nursing positions. And we do that, as we've heard in the budget, that 400 new nursing positions, right? We just have to look at what has been happening in the past. When we look at last year, Mr. Deputy Speaker, 93 nurses graduated the 12-week critical care orientation program. 23 of which graduated in January.
Order. When this matter is again before the House, the member for Brandon East will have 4 minutes remaining. The hour being 12 p.m., this House is recessed and stands recessed until 1:30 p.m.